Most people think of taxes and tax policies as issues of revenue generation and not as public health issues, when in fact, they are some of our most powerful public health tools. For example, in 2013, Minnesota raised its tobacco tax by $1.60 on a pack of cigarettes. That tax increase is generating a revenue over $200 million per year. But more importantly, at least from my perspective, the increased tax will keep more than 47,000 kids from becoming addicted adult smokers, prompt more than 36,000 adult smokers to quit, and save more than 25,000 lives. Similarly, the Healthcare Access Fund, generated by a healthcare provider tax, is supporting the Statewide Health Improvement Program, or SHIP, which is working statewide to reduce obesity, increase physical activity. Taxes by themselves can change health behaviors, and the revenue generated by taxes can be used for purposes of improving health. Because of that, the Minnesota Department of Revenue is a major contributor to public health in Minnesota. We'll talk about the role of the Department of Revenue in advancing health on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to Public Health Journal. Today we're going to be focusing on the Department of Revenue and how their work impacts health. Most people don't equate taxes and revenue with health, but they do have a tremendous public health impact. We'll be exploring that link with Myron Frans, the Commissioner of Revenue in Minnesota. Myron is a graduate of the University of Kansas Law School and had 3 decades of private practice experience in tax law before becoming the Commissioner of Revenue in 2011. Myron, welcome to our program.
Good, glad to be here. Thank you.
It's nice to have a revenuer on here talking to public health because I see the benefit. But when you think about taxes and revenue generation, is health one of the perspectives that you put in on the table when you're trying to think of where to go with the recommendations to the governor and the legislature?
Well, it actually is, Ed. You know, when I first started 4 years ago, like you, one of the challenges we faced was a $6 billion deficit at that time. And one of the challenges that we had was thinking about the budget, not just in terms of the expenditure side, but the revenue side, because there actually were not enough adequate revenues to fund our budget. But when we talked about the budget, we talked about 2 major components: the math, the numbers have to add up, and the values. What are the values going to be in our budget? And we learned early on that the revenue stream has got to support investments in education and opportunity and in health, because it's really the revenue investment that provides some really great opportunities for Minnesotans. And that's what we're really concerned about, is providing opportunities for all Minnesotans, not just for jobs, but for healthy lives too. Mm-hmm. So now, one of the things that came out in where you've been working is how income is distributed and who is benefiting, and came up with a tax on the upper income levels. And we've got some slides here that just kind of show the distribution of income. And one is a long-term trend, what's going on currently, and then what's the future looking like. So let's look at this slide that they're showing. What is that actually showing us, this income gains? One of the things, Ed, that I really like to talk about, I know I've listened to you a lot of times too, talk about trends. I think it's always important to know where you've been and where you're going. This slide shows us what's been happening over the last decade, or the last century, I should say, in terms of income. It used to be, if you look in the early 1900s, that the top 10% of the families that earn income earned about 49% of the income in 1927, which is a pretty dramatic change. You can see even in that early part of the century that was climbing up and up and up. And then World War II, or the Depression first, and World War II changed that. And we saw that the income got redistributed more evenly throughout the country. And you can see in the slide there that in the 30s, 40s, 50s, and 60s, the top 10% of the families that earned income received only 33% of all the income in the U.S. But that started to change in the late 1970s. And so what's been happening since 1977, 78, we see the top 10% income earning families in the United States, they now, as of about 2 years ago, earn 50% of all the income in the U.S. every year. And that's a pretty dramatic shift back to what happened almost 100 years ago. And we're concerned about that.
Why is that important?
Well, because one of the things we talk about in this country is equal opportunity. And equal opportunity means that everyone has a chance to get a job, get an education, take care of their family, and invest. But as incomes get distributed unevenly in society, what we see is that the top income earners at the top earn more and more of the income, and those in the middle and lower income earn less and less of the income. And so it's harder for them to buy health insurance, for example, or to go to college. So this income distribution, where more and more of it's concentrated at the top, is a concern of ours.
Okay, and so then the next slide kind of shows where we are currently, and tell us what this is, what we're looking at here.
Well, on the last slide we saw that there was this, from the 1970s until now, there's been this increasing income concentration at the top, and this shows what's happened in the last 3 years, from 2009 to 2012, after the recession, after we started recovering, because we wanted to see what's happening is with this new recovery after the Great Recession. Are the incomes being better distributed? We're finding out that's not true. What's actually happening is things are getting worse from an income distribution standpoint. If you look at the slide, you see that the bottom 99% of all households in terms of income in those 3 years earned only 5% of all the income gains that occurred during that 3-year period. The top 1% got 95% of all the income gained in that 3-year period.
So the rich are getting richer?
And faster. So this is a concern that this trend is not only happening, but it's accelerating.
And then, so what do we look like in the future? And I got another slide here that sort of, I think you put together to look a little bit farther down the road. So what are we looking at in terms of the future growth?
In Minnesota, we try to measure, as you know, there are a lot of measures we try to do in Minnesota. In Minnesota, we try to measure the tax burden on families every 2 years. And what we've been doing is we've been finding that those folks in the middle income brackets, you can see here, what we've shown in this slide is that we've taken the population in Minnesota and we've divided it into 10 equal income deciles. I mean, then we try to figure out how much income tax, property tax, state sales tax, do they all pay, and then we attributed that to each household. You can see in the middle that the people in the middle income brackets pay about 11.7% of their income to state and local taxes, not federal, just state taxes. And the top 10% pay about 10.8%, and the top 1% pay about 10.7%. This used to be a little bit worse a few years ago, but in Minnesota, as you mentioned earlier, we did add the new fourth income tax tier for the high income earners. So in Minnesota, we've tried to even this out a little bit, tried to make the tax system more fair and distribute the burden more evenly throughout all income levels. So we've made some progress.
Okay, so certainly in my world, as I look at income inequality, the difference between the highest income earners, in the countries that have the greatest disparities in income, their overall health is the worst. And in areas where they have more income equality, all longevity and infant mortality all get better. Are you seeing, is that part of your calculation when you're working here in Minnesota on these disparities, huge disparities?
Yes, we're trying to, well, what we see is that as we distribute the income tax burden more fairly, a couple things happen. First of all, we get more income. I mean, one of the things that happened when we added the fourth income tax tier was we got over $1 billion in additional revenue because of the income taxes paid by the wealthy. But the other thing that we saw is that it gave us an opportunity to provide more healthcare investment and more education investment, tuition freezes, for example. So by taking some of that revenue and making those spending opportunities at the right income levels, we've seen a broader range of our population be able to participate in programs that we've never seen before.
So what kind of pushback do you get from the high-end folks in terms of, well, why should we be paying more than we're paying now?
That's a great question, because actually very little. I get a lot of support. When I travel around the state, I get a lot of people who come up to me and say, you know what, I think that's right. I'm willing to pay more or my fair share, but I want to make sure it's being invested wisely. So there is this connection. Most people, especially in Minnesota, they see that Minnesota works. We get things done here. Programs work, we're efficient, and we take care of folks. And the people who will pay more tax are willing to do that if they can see the tangible benefit of their tax investment, because taxing really is investing in your community, and a lot of people really see that. So not as much pushback as you might think.
Okay, good. Well, we have a bunch of other issues to talk about, but first we need to take a little break. So I'll be back right after this message.
So, same time next week?
Well, of course. Put away a few bucks, feel like $1 million. For free tips to help you save, go to Feed the Pig.
Welcome back. We're talking about tax policies and revenue generation in Minnesota with Minnesota's Commissioner of the Department of Revenue, Myron Frans. Myron, before we get into some other little specific taxes, I want to just kind of go back to the tobacco tax, which we worked on a couple of years ago. What was your thinking in terms of how you could sell that tobacco tax to the legislature and the governor and things to make it really, because I see that $1.60 that we had a tremendous impact on health, but I'm sure it wasn't a slam dunk in terms of, okay, let's just raise taxes because it's a good thing to do.
No, that's one of the challenges, I think, in any kind of a tax increase that's a sales tax is that it's regressive. So all sales taxes are regressive in the sense that people with lower or middle income tend to pay a higher percentage of that tax than do the folks at the upper end of the income scale. So there's always this concern that if you're going to increase any kind of a sales tax, especially a tobacco tax, because it is even more regressive than your standard sales tax, you've got to be concerned about what is that doing from a tax policy standpoint. So when I was advising the governor and other policymakers in the Senate and the House, they were all concerned about that. But the number one reason I think they all were able to get beyond that and see that the overall benefit was great was because they treated it as a health tax, a tax that was designed to raise revenue to address a health problem, and they all want, the goal of this revenue stream is for it to go away. We increased the tax on cigarettes dramatically, as you said. We're now the 8th highest excise tax in the United States. But the goal is for the people to quit smoking and for young people not to ever start smoking and to help reduce the cost of the healthcare costs with smoking. So this goal is for this revenue stream to disappear, which is a little bit unusual from a revenue standpoint.
Well, it would certainly be good from a health standpoint if we got rid of tobacco use.
So that's our goal, and it was the health goal that got all the policymakers to sign on to this. It was not the idea of the revenues. We'll use the revenues the best we can, but that's not why we did it, I don't think.
So let's talk about something else, the working family credit that I know that's in the works as we're looking at another legislative session. And we've got a couple of slides here, one that shows the working family tax credit for 2-children families. So maybe you can walk us through this and explain, because it's not immediately evident of what this is.
Oh, you can tell I like slides, right?
Yeah, you like numbers. That's good from a revenuer.
Numbers. It is about the math. Well, one of the things that's really great about the working family credit is it works in connection with the earned income tax credit at the federal level. Both of these credits are designed to help working families who have earned income and who have children to get some tax credits to relieve their overall tax burden. So really it provides tax relief and income assistance for low and moderate income families. So what you see with this chart is you see that when you begin on the bottom left there, that as your income goes up, your tax credit goes up. This is a working family credit in Minnesota for 2 children. So you can make it all the way to $2,000 when you make about $17,000 a year in earned income, and you get the maximum credit there for a while. Then it starts to phase out, and it phases out. Now you look at the green line, it phases out about $49,000. The blue line underneath was the old law. We changed that because it was complicated. It didn't make a lot of sense. So in 2013, we were able to make this change, and now we have more credits, and it goes for a longer income period, but it provides up to $2,000 for a family with 2 children if they have earned income of at least $17,000 or so.
Okay, so this actually puts more money in families' pockets.
Yes.
And which is really important as families are seeing, because the next slide shows where some of the dollars have to go to actually make a living and make life worthwhile here in our state.
Well, this next slide is really interesting because I didn't realize how the cost of childcare had gotten so expensive in Minnesota. Minnesota is like one of the 3rd highest states for childcare costs. You can see that the average family of 4 pay a little over $800 in rent each month, and they pay a little over $900 in food, but they pay almost $1,700 in childcare for 2 children. And that is really become one of the most expensive parts of their budget. So one of the things that the governor proposed this last year that we didn't get done, that we would like to do this next year if possible, is to increase that child care credit so that more families would get more money to help with child care costs. And it's really it's an important one. I think the next slide shows you the governor's proposal. You can see the red on that, this next slide shows you that the current credit goes up to about $1,400 per family, and it phases out after about $37,000 in income. What we would like to do is have that income never phase out, so there's no income cap on it, so that it would increase the number of families that would qualify for the dependent care credit by about 134,000 families, and it would really spread out the opportunities, because we have more working, we have fewer working mothers in the workforce now than we did 4 years ago.
Well, in Minnesota, used to have the highest number of working mothers in the country. So actually going down?
It's going down a little bit, and we think it's in part because the cost. I mean, when you think about the cost, if you have 2 kids in daycare, that's anywhere from $10,000 to $20,000 a year, and it's not easy to get a job that pays for that and then enough to make the difference up. So we're concerned about, you know, what are the challenges for young families with kids, 2 or 3 or 4 kids.
What kind of studies have shown that these kinds of tax policies work actually in keeping people in the workforce, or, you know, allowing them to really afford child care? You know, what kind of evaluation do you do on the effectiveness of these kinds of things?
Well, in fact, one of the things we want to do, we don't do enough of that evaluation. One of the things that happens with our tax code is that we don't always do a study of where the money goes. It's in terms of finding out how effective tax policy and tax expenditures are. Now, we know that the earned income tax credit's been studied a lot at the federal level, and there's a lot of good studies that show that the earned income tax credit and the working family credit, those credits that are designed for working families with earned income, we know those actually get to the right people and they're very effective. The dependent care credit, we really don't have the same kind of studies. We're pretty sure that that will happen, but one of the things we're going to be promoting in the next few years is to study every new expenditure on the tax side to make sure it actually gets to the people we want it to get to. Because tax policy, if you're not careful, is not always the most effective, efficient way to get dollars. For example, there are other ways to provide money, direct subsidies to families with child care costs, and that's another option that some people want to do in addition to or in conjunction with expanding the dependent care credit.
Do you ever look at what other countries are doing to do some of the evaluations? I know, the United States is the only country that doesn't have paid maternity leave, mandatory paid maternity leave, and the studies there show that every 10 weeks of paid maternity leave actually decreases infant mortality by about 10%. So we look at some of the international studies when we look at what potential policies are here. Do you do those international comparisons?
We try. What's hard to compare sometimes is for a lot of the European countries, for example, have a VAT, or a value-added tax. So instead of having a sales tax on each transaction, they have one tax at the sale, and that is designed, it's like 20 to 25 to 30% of the sale, and it's a large tax, obviously much higher than our sales tax, but it's a national tax, and it's designed to try to replace some of the other taxes that we have. So it's hard to compare our system with theirs because of their reliance on this value-added tax. But we do find that when they do provide these kinds of incentives, they typically, though, provide them more directly with subsidies rather than taxes. So in a way, part of my goal as revenue commissioner is to promote for the governor and study the good ideas for tax policy, but it's also to promote for your department and other departments to get direct expenditures, so you have programs to do directly what we want to do indirectly with the tax code. So we are concerned about the efficiencies sometimes.
That's why I have to keep a good friendship with you.
You do, and I will be on your side all the time, because when you're in there arguing for your budget for programs, substantive programs, I'm going to be coming in right after and say, yes, I'll raise more revenue, but just give the money to the Department of Health or Department of Human Services and let them programmatically provide those, because you guys can be much more effective, much more targeted than the tax code. We can do some broad-based
major things.
Broad-based, it's got to be broad-based and really geared toward a lot of people, then it works. But you folks can do the really targeted, specific, and then the program evaluations are easier to do for you too. So I'm promoting your programs, not mine.
All right, well, we got a few more things to talk about. First, we need to take another little break. So I'll be back right after this message.
So good to see you guys. So, what's up?
Oh, we finally bought a place.
Holy cow.
You seriously have enough saved to do that?
We've been putting a little aside each month.
Jeez, at the end of the month, we have nothing left to save.
Yeah, I have no idea where it goes.
Well, you're spending a lot on...
Was it good?
Oh, God.
Oh, how is my account overdrawn?
When it comes to financial stability, don't get left behind. Get tools and tips for saving at feedthepig.org.
Welcome back. We're talking about Minnesota tax policy with Myron Frans, the Commissioner of the Minnesota Department of Revenue. Myron, taxes are always controversial. Taxes are what funds a lot of what goes on. Taxes actually impact behaviors, and so they're really important health issues. But I want to chat a little bit about how do tax policies evolve? Who gets engaged? How are they made? What's the best approach to do it? And you've been doing this now for 4 years. What do you see works in actually getting people engaged in talking about tax policy and the pros and cons of different approaches?
Well, you know, one of the things, Ed, that I have found is that there are the folks who have a real strong perspective will find you. So on the one sense, all I have to do is go to work and people will show up and talk about tax policy. But the other answer to your question is everyone really likes to talk about tax policy. So you may recall a couple of years ago, I traveled around the state a lot as we were preparing for the 2013 session to come up with the tax policy program and tax reform. What should we do? And one of the things I did was I traveled around the city and did a lot of town halls, and I would spend maybe 15, 20 minutes talking about issues and trends and problems and then open it up for the discussion of people around the state. And it was so amazing to me how they really loved getting information, number one. So they had the facts. What are the concerns and how is revenue policy decided and what do they want to see for the future? So I think inclusion in the sense of you really need to go out as a commissioner. I think you've been out a lot and I've been out a lot. And I think that's critical, is to let people know you want their opinion, you want their input, and they will give it to you either through town halls or meetings, or they'll contact you directly. But the other thing that you need to reach out to are different groups in the community. Sometimes I think different groups feel like they're not being listened to. I mean, the business community is good about talking about taxes because they don't want more taxes, right? But that's part of their DNA. That's part of what they do, and I get that, and that's okay. But you know, but the other thing is there are other folks who do want more revenue, or they want revenue directed in a certain way. And so I think it's critical that we get out and we listen and we bring in groups and different people, because not everyone can afford to pay a lobbyist to go to St. Paul and lobby, and we can't let that be the only way we hear about tax policy.
Well, and certainly our state is changing demographically, and we've got both age-wise, we've got a large number of elderly folks, coming up, but we're also changing just racial and ethnically. We have a lot more diversity. People coming from different cultures. How do you engage people from other countries who are now residents of Minnesota, citizens of Minnesota? How do you engage the diverse community in talking about something that's fairly complex?
Well, it's very complex. In fact, I remember before I became commissioner, I was doing some pro bono legal work for the University of Minnesota Tax Clinic. And there they provide low-income folks with free legal advice on tax matters. It turns out, this is like 6-7 years ago, it turns out that there were some tax preparers that were providing really bad advice to the Somali community in particular. And they were convincing their clients to take credits they didn't really, weren't entitled to, and then they would take the money and run. So here are these poor immigrants that had never worked in the system before, had a bad prepare for their returns, erroneous credits, and so we came in and tried to get that all cleaned up for them. But one of the things we had to do was, I had a translator for a number of these cases, and it's so hard to translate, as you know, anyway, but then to add on translating tax concepts to different languages is tough. So I think one of the things that we talk about in the Department of Revenue is this plain language initiative that the governor, executive order that the governor signed. We're trying not only to make our information packages in plain language, we're also trying to make them in more than one language, so that the different diverse groups can access the information better, and then we need to make sure that we go out and have outreach programs so that we connect with those groups so that they have a chance to let us know what they're thinking. I think it's incumbent upon us to reach out more to let them know we want different groups, we want to hear from them and what they have to say.
All right, in the last minute that we have, you also are an enforcer, right? How do you enforce the taxes?
Well, you know, it's one of the things we talk about is voluntary compliance. 97% of all the revenue comes in, over $20 billion a year, is through voluntary compliance, which is great. But there's that other piece, right? And we really do need to enforce. We try to go out and enforce those people furthest from compliance, because those are the people who are blatantly not following the rules. But we go out, we audit returns and try to examine things as fairly as we can.
How about tobacco tax? Do you enforce that?
And we are. There's a little bit of smuggling going on because we do have a higher tax rate. You do see some people going to other states, and so we're working on that, and we're finding more and more seizures that we are finding people who are inappropriately bringing in tobacco products from other states.
Good. Well, thank you for all of the work that you've been doing. I know with your three-legged stool that you went across the state in many, many meetings to really argue about, or not argue, talk about taxes and their impact. And as I say, taxes are an important part of public health. So thanks for the work that you're doing.
You're welcome. Glad to.
And I'll be back with a closing comment right after this message.
Checking your fantasy league?
Nah, just my 401k statement.
Nice. Where'd you find the money for that?
I just been saving a little every month.
I can't seem to save anything.
Well, what about all this? What about the money you're spending?
What money? It's gone before I can get my hands on it.
I got a pizza for a Todd.
Hey, can somebody spot me?
When it comes to financial stability, don't get left behind.
It's $5.47.
Get tools and tips for saving at feedthepig.org.
There's an old aphorism that states that there are only two things in life that are inevitable: death and taxes. But from what we've heard today, good tax policies can actually delay death by contributing to good health. Taxes can help decrease unhealthy behaviors and also provide revenue that can be used to invest in creating a healthier society. Instead of thinking of taxes as something that we should try to avoid at all costs, we should really be thinking about how tax policy can actually be used to prevent disease from occurring and help delay the inevitability of death. Good tax policy is an effective public health tool that should be seen as a strategy for creating a healthier and more prosperous society for everyone. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.